Good afternoon and welcome to Devising a Sound and Sustainable Wireless Communication Strategy, a complimentary webinar from healthsystemcio.com sponsored by Vocera. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of healthsystemcio.com and I'll be your moderator today. To ask a question, you can just type it into the lower right-hand corner of your screen. In the Q&A box, leave the default set to all panelists and send it in. Send them in as they occur to you, and we're going to take them later in the program. You can download the deck by using the URL on your screen, and we've also got a shortened URL at the bottom of all the slides. And we are recording today's event, and we'll be posting it to our YouTube channel within 2 business days, usually sooner, and you will get an email as soon as it's ready for viewing. So you see how we're going to spend our time today. We're going to go about 45 minutes. First, we're going to hear from Tressa Springmann, VP and CIO at LifeBridge Health. And then we're going to hear from Praveen Dalla, Senior Director of Product Management at Vocera. And then we'll have our Q&A. So without further delay, I want to turn it over to Tressa Springmann. Tressa, thanks for joining us.
And thank you, Anthony. I'm going to spend a little bit of time today, as the presentation suggests, talking about our wireless communication strategy, which, similar to a handful of other things in our industry and in this space, is highly evolving. So today, I'm hoping that the participants can get some solace in the fact and learning from LifeBridge's own journey that if you're having challenges and continually relooking at this, that you're not alone. It's something that we've been doing too. So I'll be sharing our journey and the work we've done in this space. One of the things that I think is critical, but it's somewhat easy to lose sight of, is how much basics count in defining the elements of your wireless communication strategy. This is a place where there's a lot of sexy gadgets and a lot of cool stuff, and yet hopping over some of the basics, while potentially tempting, could be, in the long term, perhaps putting the organization down the wrong rabbit hole. So basics really do count. That's hopefully one of the points I'll be able to get across this morning. Also, that there isn't a one-size-fits-all. There's not going to be a slide here that tells you exactly what product to buy that fits your needs. Very similar to perhaps the EMR or the foundational systems you have there. Much of it is culture, and some of it is where you are in your own maturity and evolution of the use of some of these tools. And then finally, encouragement to frame together a strategy, and not necessarily anything extremely formal, but something that drives the guiding principles for your wireless decisions that you're going to be making as both your organizational needs and the technology continue to evolve. So again, hopefully we'll hit those goals for today. There's always the requisite introduction to the organization that I belong to, and no different here, but I think there are also some items that are relevant to the specific topic. LifeBridge Health, if you look to the left hand of the slide, very much has the traditional inpatient and outpatient, but hospital-based facilities with Sinai, Carroll, Northwest Hospitals, and Levendale Hebrew Geriatric Center. But in addition, and probably now of equal balance and certainly of equal and growing revenue, are our outpatient and our non-hospital care delivery. So our physician enterprise, probably similar to yours, is a growing employed base of LifeBridge physicians and clinicians. We have a pretty deep investment in our commercial division that has urgent care centers, physiotherapy, home health care, all those other elements of the care continuum, retail pharmacy, that we believe to be pretty essential in the provision of population health, and even health and fitness centers as evidenced here. But for today's conversation, what's compelling is that our care now really is everywhere, and so are our needs for enhanced communication. If you look at the middle part of this kind of double-sided arrow, you'll see the key acute and tertiary care organizations. And when I talk about where we've come from, you know, the needs of those hospitals, those bricks and mortar facilities were really where many of us, I know where we started and where our communication challenges were being addressed 10 years ago. And yet over time, when we talk about strategy and why those foundational elements are so important, is really to help us broaden our reach on both ends of this care spectrum, which, as all of you know, are highly mobile. So again, it's not as though it's just been the technology that has been evolving. Our care is now everywhere, and those good old days of acute care have really expanded out into the new normal for all of us. Our mission statement, perhaps similar to yours, but again, an internal influencer on our strategy around wireless communication really needs to take into account those things that we as an organization embrace. Key goal to be favored by the greatest number of patients and physicians. When you think about a wireless strategy, that directly talks to physician engagement and then in population health with patients, their families, et cetera. So even our mission statement has an influence on what we need to be considering. Our health services need to be quality, but they also need to be cost effective. And as many of you know, in this space right now, there's a real temptation and potentially sometimes a real need for multiple purchases. And yet we have to endeavor to balance the quality and the cost effectiveness. We're a teaching institution, so we have a lot of Gen Xers, millennials, and below that are wandering around both in our in and outpatient facilities to have a completely different mindset and appetite for technology, as you know, because they've grown up with it. And then finally, we have a tremendously diverse organization. We have one of our hospitals in an urban, downtown, very depressed socioeconomic neighborhood, all the way out to a hospital that's somewhat considered to be in the country. So the socioeconomics and comfort with wireless technology by both the staff, some of whom get here on the bus, and by our patients, some of whom have people drive them to our organization, they have a different appetite and comfort level with both how they communicate from a much less traditional to a more progressive method, as well as the tools they use. So we found that even our mission statement is an important thing to pull out and kind of bounce off of the framework of what you're trying to tackle with your strategy. From a historical perspective, LifeBridge Health identified about 10, 11 years ago that there were some real clinical communication challenges on this timeline. That really was back in the days when this was within the four walls of those hospitals. And at that time, made a pretty sizable selection and investment in the Vocera tools, specifically targeting our nursing and non-physician clinical staff, you know, really enhancing that inpatient-oriented communication among care providers. Ironically, that toolkit never really took off in the hands of our physicians. And that's just something to tuck into the back of your head. I wasn't here then, I'm not sure why. And frankly, I think that originally this was positioned to help us with improving nurse communication. As all of us know, the advent of new tools came along, and LifeBridge Health standardized from a corporate device strategy on the BlackBerry in 2009, and then migrated their corporate device strategy to Apple in 2012. At the same time, all of us began to recognize the other trade-offs with these new smartphones, not only the neat capabilities of taking pictures and sending texts, but also the vulnerability of using those technologies to do it. And that's, you know, that's always a tough balance, because as humans, we're going to whatever tool is going to get it done the quickest and most efficiently for us. And sometimes those more subtle aspects of security as a barrier to good communication aren't given the weight, at least back in the day, that they should have been. So the last couple of years, again, probably very similar to other organizations, we've been investing in how do we make our own environment more secure with mobile device management, developing standards and an appetite around folks bringing their own devices into the workforce, considering how this wireless movement and smartphones give us the ability to better leverage our medical records from an alerting perspective, and then really looking to the future, understanding that heightened pressure, but also emphasis on really effective communication is just growing. It's not going away, and we'll talk more about that. In the meanwhile, as you'll see at the bottom end of this timeline, those 1,500 wireless devices haven't gone away. They've grown to over 4,000, and just on that network alone, we're fielding 100,000 calls per week. So it continues to be a mainstay in our acute care organization. Here we go. So when you think about the strategy, we can't discount those external factors on us, right? So in the environment today and the situation that health systems face is that the same factors outside of our industry that are influencing our lives, our kids, the public sector, is this sense of being always on and an ability to communicate continually. That is really the new normal that we're living within, and this immediate feedback expectation. You know, Facebook isn't even cool anymore. Folks are moving to Twitter and to Snapchat and to just kind of immediate reaction and communication conduits. With that, in the public sector, there doesn't seem to be, especially with the folks who are real power users, that same sense of concern for keeping confidential and secure the information being shared. So those are some interesting factors at play. And while there's this sense out there that we have an environment where the devices and the carriers and the wireless networks are all agnostic, those of us in the industry absolutely know that we haven't achieved that yet. You know, we've got applications and situations that certainly run on one OS and not another. We have perhaps infrastructure that supports certain carriers more favorably than others, et cetera. So, you know, driving around town, it may not always feel that way, but we know within the healthcare institutions that this external pressure for immediate on, always on and immediate feedback has got a few barriers in our own environment, especially understanding the responsibility that we have to be ever more diligent in the protection of the information of our patients, even as our workforce becomes more mobile. So what's convenient to care providers may not be as secure, and, you know, having said that, there are also some complicating factors with employees who perhaps, because of the manner in which they're paid, can't even be expected to be always on. So we've got to compete to attract these physician groups and to make sure that the physicians as our stakeholders, unless you have a completely employed model, find that we're offering them very, very convenient communication tools when they're taking care of patients within our environments and with our care teams, but not doing it at the expense of securing that data. And I mean, that's a bit of a tough balance to strike in some regard. In addition, we all recognize, and I don't know if it's at an even higher awareness here in Maryland, but I know certainly here we are getting paid or not getting paid and potentially being penalized based on patient satisfaction. And the surveys out there today, the majority of the dimensions that really have an high impact on the overall outcome of your organization's scores are around communication. I know about my meds, I know about my discharge, communication with my doctors, communication with my nurses. This is super important in the context of really providing a high-quality service. Patients can't always measure the clinical care they receive, but they certainly can understand the way they were treated. And that's in this always-on, immediate feedback response environment that we're living in. So as consumers, our patients, their families, our physicians all want these conveniences from our care teams and from each other that they receive today from Uber, Amazon, their hairstylists, and not just whenever, like scheduling a physician appointment on a portal on a PC in their home, but also wherever, sitting in the parking lot waiting to pick up their kids from school. In addition, we have to remind ourselves that without perhaps even the perfect technology, we can't continue to put tools out there that are standing in the way of effective workflow and are becoming a barrier and not a support tool to the way our nurses, our MAs, and our practices in our inpatient settings are taking care in the interest of making sure we aren't taking them away even more from their time with the patient, whether it's here in an inpatient setting, in the ED, away from the bedside, or even in the physician practice. We've just got to make sure that the technologies are supporting the workflow of the provider and accelerating or optimizing that communication and not the reverse. So I'm sure many of us, I know we've been faced with when do you pull the trigger on BYOD or corporate owned, and how are those decisions made around devices? And right now I'm just talking about communication devices, but certainly you can throw in tablets, laptops, iPads, Surface device, tablets, et cetera. Obviously, consumer convenience is something we all want to take advantage of. Folks come to work with their own devices, and yet that introduces a specific level for security. And the needs of the clinical staff and the executives can be very different. As I said, you know, there's a public expectation that there's an always-on mentality, but certainly in the organizations I've worked in, the physicians and the executives, there is an expectation that we're highly connected and maybe not always on, but absolutely always accessible. And so many of us still have a corporate-provided device or a corporate-provided plan for those people for whom this is an expectation. But that then is blended with an environment of patients and other staff members where perhaps it isn't the expectation that they're always on and accessible, but they have that expectation of high connectivity with us. It's also complicated a little bit, maybe not complicated, but it's influenced by where your own organization is on its maturity curve using wireless technology. So, you know, we have this idea, and for us it's also a mission, that we don't want to spend money twice. We don't want to necessarily have a point solution for secure texting that needs to be replaced later, but how do we combine that with an organization that has come to embrace and favor a hands-free experience, and in an environment where we've got folks coming and going who also desire to connect in and on with the network, and yet when they're off-premise have a different technology experience with us. Again, in our organization, we have staff members that when they're not on the clock, I've got to make sure that we don't have an expectation that they're using their own tools or doing any work-related activity, even on their own device, when they're not here on campus or off the clock, because they aren't reimbursed for it. It can't be an expectation of their employment, and yet in their mind, it's certainly a personal convenience. So we see ourselves continually reassessing corporate versus BYOD, even in the context of owning secure texting and MDM tools, because they're just additional layers of expense, but a continual rebalance of, if you will, convenience for control. I think very recently there's been a lot of public press about some of these breaches. You know, we've seen a lot of articles where certainly there's some organizations that are completely pulling back and saying our culture and our posture is going to take a position that BYOD isn't just, it's not just going to be, you know, part of our core competency. And certainly that's an influencer on your wireless strategy. So the future of healthcare is here. Perhaps that's a bit of an overused statement, but while we remain in this kind of ugly, evolving, no single solution situation, progress is marching on. The reach of my organization is getting ever bigger, more mobile, more diverse, beginning to cross states, et cetera. So there's really no use in sitting on the sidelines. I think just like many of these other technologies, it's going to be a when, not an if, in terms of it evolving and catching up. But there then does put the pressure and mandate on us to aggressively and continually revisit both what's out there in the market to help us solve the challenges and meet the needs of our organization, but reframing that with the balance of access with security. You know, innovation's happening, it's going to come, and we can't let our current circumstance suggest that we don't have to continue to have this need to change and improve so that we can meet the goals of our organization and yet still protect the information that we hold dear for our patients. So from a strategy perspective, putting the foundation together is essential that it be interdisciplinary, because while the environment might still be blended, that means there are going to be trade-off decisions that need to be made. And as many of you already know, if you've got broad engagement across the participants and they understand the barriers and or the challenges that other parts of the organization are experiencing, there can be really robust conversations about these trade-offs, especially knowing that there hopefully will come a time when those trade-offs won't have to be as big. So this interdisciplinary approach is certainly key, from just the practicality of the economics of not being necessarily, at least in my organization, able to buy lots of different point solutions that are preferred by individuals. And again, duplicative investments in different BYOD, non-BYOD, and secure texting approaches that folks have. I also have to mention, I think I did touch on it earlier, it's really essential that you work on the foundations. I think that communication is just going to continue to explode and become more ubiquitous. It isn't out of the realm of possibility. I know we're already in there with both feet, that population health has us developing communication tools, managing physician preferences, beginning to manage patient preferences through standard sales, CRM, customer relationship management tools. And so this is just going to be an incredibly important element in population health and trying to understand preference around the way people like to be communicated with. Sure, there's email, sure, there's phone. There's always going to be some traditional means and face-to-face, but we've got to make sure that we're also anticipating the wireless elements of that. Another foundational conversation that you got to look eye to eye with is, what's your organizational risk tolerance? As I said, there's some organizations that have said, you know, we're not even going to do the BYOD thing, just too complicated, too risky, and that's a decision on what level of risk an organization wants to take. Also, this idea of where you are on the maturity curve for wireless. You know, if you've been a long-term user of a hands-free environment, as we have been, good luck saying to folks, we're going to give you texting, but we're going to take away hands-free. These aren't really either-or conversations. So it's critical to identify and use this interdisciplinary governance structure to make the tough prioritization choices, and keep that structure in place so that as your choices change, you can keep revisiting and hopefully making more ideal for all constituents the circumstance. So, you know, those things to consider is obviously secure texting, hands-free, whether or not that is a consideration or not for your organization. The degree which inpatient or ambulatory EMR integration or even pop health tool integration might be required. You know, those care managers in the future who need to know when an uncontrolled diabetic landed in one of the state's ERs. So integration with other functionality. I know in our organization, on-call schedules are always being accessed, and so some of the solutions we have in the wireless world integrate and make that really convenient for some of our physicians, which to them is probably the most important function. How important is it not to be wearing multiple or carrying multiple devices? Again, an interesting and tough conversation in an academic environment. The fact that I mentioned earlier and the barrier that the operating systems can sometimes pose a challenge to us. Are we going to be an environment where it's worth making the investment that it can be Microsoft, Android, iOS, or are we going to have to standardize and just make some choices, because that drives our size of our support team, the size of our budget. You all know these things. And, of course, access to funding. We're all in different economic states, and none of us can really lose sight of that. That has an influence on our decision-making. Don't discount the key technologies you have in place also. We've already got competition for the wireless networks, especially in our hospitals, in our hospital setting. Many of you may be familiar with the multi or single carrier DAS that might be helping boost one cellular company's strength, but not all. You know, MDM, it's a nice advantage, but it comes at a cost, et cetera. So all of these, technology, risk, functionality, should be taken into account in these foundational elements. And then just like HIPAA, they're the administrative controls. There's having an ongoing committee or governance structure that does all that heavy lifting of putting policies into place that probably have to be revisited with some degree of frequency around BYOD, personal devices, stipend, appropriate use, what kind of support individuals can expect if they choose to go in one direction versus another. You know, it's a good time to pull out the HIPAA privacy and security, the policies we put into place with HIPAA privacy and security. They have relevance, but some of the tools have matured to a place where there's really kind of a whole different set of characteristics to consider and perhaps some policies to refresh in that situation. Then you come down to the right device. You know, is there a right device? Well, depends on who you ask. Not only do clinical roles have different device needs, as we all know, not only is medicine getting personalized, the choice of the device type is getting highly personalized. You know, the ED may have a different appetite for mobility than the labor and delivery team, and yet on the other hand, as we're all learning, even within that group, you know, you certainly have the Droid constituents and the Apple constituents, et cetera. We just need to embrace the reality that there's no longer just going to be, you know, one hammer that's going to solve this. And we need to really just acknowledge that and embrace that and continue to socialize that idea in our own organizations and with the decisions that we make. So from a solution perspective, in this ever-changing field, it isn't necessarily just one right tool. I think it's really critically important for an organization to take a look at the vendors and determine a fit with the vendors in this space. Now, understand their roadmap, understand their innovation, their R&D, where they're headed, what they think is really important, how well their own roadmap fits with those foundational elements of the strategy and the needs that you've defined with your team and your organization. You know, they're not going to have things out of the box today that necessarily fit all your needs. And so really assessing that vendor fit is critical. Can they be a good partner for us based on where they're headed and where we're headed. Super important. Not an era where we're just sitting in demos saying, yep, that fits the bill based on our requirements. Much of it is around philosophy, culture, fit, and really the future of their R&D. It's a highly evolving technological space, and it probably requires real good decision-making, more about that partnership with a vendor and vision alignment versus what's just being, so to speak, sold off the truck today. Pilot the deployment, try it. I mean, we're in the middle of like 3 different types of pilots, and while it takes a lot of energy, you really do develop an opinion on the subtleties of what might not work so well that could become a massive frustration when deployed across, the 13,000 employees that we have. You got to let your use cases drive the ultimate decisions. Take those use cases, select the desired requirement, pilot and apply the intended solutions in those use cases to ensure that it's supporting, again, and not interrupting the workflow or becoming a barrier. Clearly, adoption, we understand, is critical. So that interdisciplinary team can assist with this. They can help us communicate the vision versus some of the trade-offs we've had to make in the near term. And again, ideally, it should take into account not only where our organization is today, but the growth in remote and affiliated physician practices, new hospital acquisitions, urgent care clinics, those areas beyond the confines of the hospital. So from a key learnings perspective, just to recap, these technologies are evolving. Super important to stick to the basics and develop some foundational guiding principles for the decision and the direction you take. Focus time on risk. Understanding, I would suggest that you're not shopping for a thing but a relationship, and if you can afford it, perhaps multiple. And really not to be constrained by our thinking of the past. We can't abandon some of those good things that have worked well for us, but we can't allow them to not think much more broadly with our arms and eyes open about where the technology is taking us. One of the things that I found, it was a quote from Forbes magazine that I especially liked in this regard, and I'll close with it, is that with digital transformation, it's really the consumer rather than the technology that's in the driver's seat. And that's critical and it matters. Thank you for your time today, and I'll turn it back to Anthony.
All right, Tressa, thank you so much for that great presentation, and we're looking forward to the Q&A. So now we're going to hear from Praveen Dalla, who's Director of Product Management with Vocera. Praveen, thanks for joining us, and thanks for sponsoring the event today.
You're most welcome. Thank you, Anthony. And thank you, Tressa. Your approach to deploying wireless mobile communication strategy is solid. I particularly took note of the last part there. It is the partnership. It is not really the technology that one should look for. One of the other takeaways for me is your strategy to address 3 key aspects of a successful approach to deploying mobile communications, right? It is people, process, and technology. I understand technology is third. First is people, second is process, then it is technology. And one needs to be very conscious that it is, workflow that actually drives technology adoption. It is not technology for technology's sake. It is actually workflow that should pick the right technology. As Tressa mentioned, there are lots of interesting products in the market, but it is so important to first look at your culture, people, and workflows before you say technology. And, in many communication platforms deployments, Vocera has driven, we find that, the people who are most successful are people who bring the people together first, then carefully consider how communications and workflow is optimized, and then look to how and what pieces of technology make sense to fit into that scheme of things. And unfortunately, we do see quite a few out there who are driving it upside down. That really doesn't, that really results in point solutions and not really a solution across the system asset that works for the entire system. And as Anthony mentioned, I'm the product management team at Vocera to take care of all mobile applications. Going on to the next slide here. And what Vocera offers, our goal at Vocera is to help our healthcare customers improve clinical efficiency and the patient experience. And that we do by empowering everyone in the care team in the continuum of care with delivering the right communication to the right person at the right time on the right device, and it could be hands-free or a smartphone or something else, and with the right information anywhere inside or outside the hospital. So we look for the continuum of care. We are not looking for inside the hospital only or outside the hospital only or a single mode of communication. We actually go to a multimodal, and the deployment end of the day has to be an intelligent platform that knows what the endpoint is and is context sensitive and delivers into the right context the right kind of information at the right time. If you look at our overall vision of an enterprise-grade communication platform, we are very patient-centric in our approach. What we know is there is extensive data layers available out there amongst hospitals, and there's multiple sources. There's EHR, there's clinical systems, et cetera, and all those data triggers typically trigger a workflow, be it a voice workflow or it could be textual or data workflow. And we focus in on that. What we provide is a communication and collaboration layer that takes the output of the data layer and translates that to whatever be the vertical of operation. It could be a physician's clinic, it could be an ambulatory or outpatient clinic, it could be acute care facility, all the way extending to home care, but really focused around the patient to look at what kind of care is being given, what kind of data triggers what kind of communication, and delivering the communication to the right endpoint at the right time. Again, multimodal is key when it comes to that, and the choice as well. I mean, you cannot expect, for example, a transport tech needs immediate voice communication. They really don't need vital signs. On the other hand, ICU nurse actually needs vital signs and needs communication and needs both text and voice communication. So there is a variety of communications that are needed, and the right type of communication delivered to the right type of device is critical when you're looking at enterprise scale deployment, actually the right technology for an enterprise as such. So that is what our vision is, and that is where we are, and that's what we are looking to strengthen as we go forward as well. And so what we offer is actually a very powerful software platform on which we can deploy the multimodal communications that I was talking about. And it is not limited to voice, by the way. I mean, Vocera, I know, is very well known in the voice world as such, but it is not limited to voice and our hands-free communication, but we can actually go to enterprise-class smart devices. We can go to the iPhone, Android platform as well, and we also have tablets and desktops into which we can push communications and information to. And there is a layer of workflow that we bring in. So in addition to that, so we have voice workflows that might go to hospital staff. We have secure texting that can go to a physician. We could have clinical integrations and workflows that go into acute and post-acute care. And we have our patient engagement platform that works seamlessly with the rest of the infrastructure here to work with the patient engagement side on the patient satisfaction aspects. So it's actually a wide, enterprise-grade platform that conforms to what your hospital's specific needs are. As you bring people and process together and start looking at technology, we offer a variety of technology that works to fit an enterprise-class deployment to fit those needs. Back to you, Anthony.
All right, very good, Praveen. Thank you so much for that presentation and for sponsoring today. So now we have time for a little Q&A with Tressa. So go ahead and send your questions in the Q&A box. Leave the default set to all panelists. Let me get started, Tressa. Let me ask you, you mentioned you read about a distaste for multiple devices. Obviously, that's on the IT side because it's more difficult to manage. Your users want to use what they want to use. Some of them may want to be issued a device from the organization. Some of them may want to use their own device. So you're dealing with a lot of people, a lot of concerns on security on the inside, a lot of different tastes from the physicians and that type of thing. And you talk about making decisions. Any advice on how to get to the point of making a decision with so much at stake and so much going on?
I think that's where we've relied on the governance and the engagement of various constituents. You know, there's no way to jump over the hard work of talking about roles and requirements. You know, Praveen mentioned the transporter and the nurse and the physician and the IT person. And, you know, there is a heavy lift here where, as an organization, you've got to go through those different roles and define what are the communication expectations that we have of each of these roles for a best-in-class communication, and how are we comfortable supporting it, and then use that to start helping to drive decisions. Then it becomes influenced not only by what do you need to do your job well, but then, you know, how do we address some of those other factors like employee engagement or employee satisfaction or physician satisfaction, when we know that the solution we have to offer that will support effective communication may not necessarily result in that individual wearing or using just the device they came to work with. So, you know, I have to go back to the fact that you're not going to be able to gloss over this. You got to start with the fundamentals. You have to be really comfortable talking about the detail, what people need and what influences them otherwise to be effective.
Right. You talk about competing to attract physician groups. When physician groups are, and I don't know exactly how this works, but if physician groups are contemplating which hospital they're going to be mostly referring to, and do they want to come in and have a conversation with the CIO, and do they want to understand what kind of technology they're going to be given or empowered with by each of the health systems they are looking at, and then you have to sort of make a very appealing pitch to them of, oh, you're going to get this and that and all these tools. Just tell me a little bit about how that works.
I'll give you a more practical example, and that's the phone call I get from a very influential, very effective, very clinically well-known cardiology group whose AT&T cellular plan doesn't get any signal in my cath lab. And that's not a, I'd like to come in and meet with you. That's a call from the hospital president for an on-demand performance about what our options might be.
So then you have to go ahead and get a signal out there.
Well, you need to have that conversation, because to get a signal out there, in that very specific situation that we did a lot of research around, you know, that was six-figure investment in order to address those physicians' needs. Either that or figure out a way to get them on a different cellular plan. So, you know, there are those balancing, competing needs for being cost-effective, but also very physician-friendly in that circumstance.
Right. But security's got to be paramount, correct? I mean, no matter what you're looking to do to please physicians or anybody, I mean, is that how you operate? Is it basically we can do a lot, but we will not do anything that compromises our security?
Absolutely, or the access to personally identifiable health information. But as you know, especially with smartphones, I can say that, but I can't enforce that. I can't enforce folks walking around the organization inappropriately choosing to use their own cell phones and to text each other about patients.
Right. Yep. You mentioned establishing a privacy and security committee. Any short list of important folks to have on that?
Yeah, let me kind of think around the room, the folks we have. We have our Chief Compliance Officer. We have our Chief Security Officer. We have our CTO. We have internal audit. We have our legal team. And we absolutely have human resources at the table. I mean, many of us are aware that aside from technology and, you know, cyber risk and liability and breach control, that education and awareness and engagement and support by employees, because largely that has been the largest source of a lot of our problems, is really, really important.
And is HR, is marketing separate? Like the marketing department, I would think, would help put together educational programs, but maybe HR handles that with marketing?
Well, we on an ad hoc basis, have marketing engaged to help with overall organizational communication. But the HR team is the one that puts together the curriculum or workforce development in concert with the committee. Good.
All right, I just have one more question, actually a little discussion point, and then we're going to conclude our event today. I mean, it's a fantastic line. Praveen even touched on it. You're not shopping for a thing but a relationship. Obviously, that's a really good takeaway. Tell me about how you shop for a relationship when you have multiple pilots going, and when you look at these organizations. How do you shop for a relationship? What are you looking for? People change, right? I mean, you get to a good relationship with somebody, and if you use that as a basis for a purchase, well, next thing you know, they moved on to another job. So tell me your thoughts around that.
Yeah, and I apologize if I made it sound like it was a personal relationship, although that's important too. You know, we want vendors who don't feel they're being taken advantage of, and vice versa. We really, here at LifeBridge at least, want partners. But it's a critical assessment of their product roadmap, their ability to deliver in the past. One thing I may have failed to mention is to really step back in your own organization and identify who you're already working with. You know, similar to pop health, big data, et cetera, there are a lot of people that are probably already vendor partners of yours that are moving into this space, have moved into this space, may even have some core competencies in this space that you shouldn't discount because they're a known partner. So really, product roadmap, ability to deliver, not hard to find out a vendor's reputation in terms of meeting their delivery dates and or being able to deliver on the vision that you or other sites that experienced or didn't experience. Certainly, you got to reach out to your peers, you know, whether it's through Chime or HIMSS or some other industry type of association where you're understanding what are they thinking and are they experiencing the same things, and not being afraid to kind of pick up those tidbits and share with each other. And recognize that, you know, there isn't any one person or organization that probably has an ability to solve the whole problem. But when various people share their own concerns or level of adoption or approach, I highly believe that folks who are still open and willing to learn are certainly going to learn something they can bring back to their own organization.
Excellent, excellent webinar, excellent presentation and Q&A. I want to thank you so much, Tressa, for doing this with us and sharing with your peers. I want to thank our sponsor. I want to thank Praveen for speaking and Vocera for sponsoring. As I mentioned, we are recording today's event. We'll post it to our YouTube channel within 2 business days, if not sooner, and you'll get an email when it's ready. For those of you who have the Chime CIO certification, attending our webinars gets you 1 CEU. Let Chime know you've attended, or if you've asked us to do so, we certainly will. Sponsorship opportunities for events like these, please reach out to Nancy Wilcox. And general questions and comments, you can reach out to me. Also, go to our website to see our upcoming schedule of webinars. So with that, I again want to thank Tressa and Praveen and all our attendees, and everybody have a wonderful day. Thank you.
Thank you, Anthony.